Good afternoon. Thank you for joining us today. My name is Diana Harris. I'm the lead for strategy and operations here at ARACY, the Australian Research Alliance for Children and Youth. Today is the second of our webinar series, Productivity with Purpose. For this series, we have partnered with the Centre for Policy Development to respond to the Treasurer's invitation of a few weeks ago to come together and talk about how productivity can lead us towards a better future for future generations. The Treasurer said in his announcement of the Economic Reform Roundtable at the Press Club a couple of months ago that the purpose of productivity is intergenerational fairness and equity. But if we are going to take this opportunity that has opened up, we need to be thinking about what productivity is, why it matters, and whether the ways we've thought about productivity previously are going to get us to this new future that we can all imagine for the children and young people that we serve. So today I would like to welcome a fantastic panel of people who are going to talk to us about some of the hows of the ways we can change up how we do things, how we think about productivity, how we deliver services, and how we share power and engage children, families, and communities in the things that work for them and what they want to see to make their lives better. This is not just about budgets and economics. Those are the tools that we use. But at the heart of it, this is about people. And today we'll be talking about how we can bring those two things closer together. So I'd like to introduce my fantastic panel. Joining us from the Centre for Policy Development, two of the authors of the report released on Monday that shares the title with these webinar series, Productivity with Purpose. That's Adelaide Scholtezik, I hope I've got that right, Adelaide, and Ryan Martin, who are both policy advisors with the Centre for Policy Development and, as I say, co-authors of that report, which you can find on the website and is well worth a read. Also joining us, we have Kerry Staines, who is the CEO of First Nations Advocates Against Family Violence, and Ryan Martin. I've already introduced Ryan, and Caroline Crosavalo, CEO of the Front Project. So this is a panel that we have brought to you together today, but before I bring the people in, we'll just do a little bit of housekeeping, which is to remind everybody that this webinar will be being recorded and will be available on the ARACY website in a few days, and that this is the second one in a series, and there will be a third webinar taking place after the Economic Reform Roundtable. I'd like to start, before we bring our panel into talking to us today, with an acknowledgement of country. For me, that is Ngunnawal and Ngambri country, the country that I grew up on and where I now raise my children. And I'd like to pay my respects to the traditional custodians of my country and thank them for their ongoing stewardship. I'd like to pay my respects to elders past, present and emerging, and I'd like to extend those respects to the elders and custodians of all the lands of people joining us from all over Australia today. Many different lands, all in common, that they are unceded lands belonging to First Nations people. And I'd like to extend my respects to the First Nations colleagues who are with us today. If you'd like to drop into the chat where you're coming from, it's always lovely to see where across Australia our friends are joining us from. Okay, so we shall get into it. The Productivity Commission has been drip feeding us a range of reports which are inputs into the Economic Reform Roundtable, and a very relevant one dropped last night, 10:30 p.m. I don't know if you guys were reading it at 10:30 p.m. like I was, but it's there and it's got a lot of good stuff. But before we get into the details, Adelaide, you are probably the best place to start us off on this question. Productivity, as is traditionally thought of, is more widgets, things you can count, to quote the title of another Productivity Commission report, things you can drop on your feet. It doesn't necessarily fit too well with social services and the care economy. So what needs to change about the way we think about productivity?
Thanks, Diana. So firstly, we really need to think about how we reframe productivity itself. It should really be a tool for advancing the well-being of people and planet, and not one that we kind of relentlessly pursue for its own sake. Of course, it can be a useful tool, but only if it leads us to our desired goals. So saying we should just increase productivity at all costs can actually be harmful to our society. And the care economy is a great example of this because, as you said, the way we currently measure productivity in social service does not actually reflect its social value to our society. And that's because traditional productivity is usually determined by the price of a service. But I think we would all agree that you can't really determine the value of a social service by its price. Social services are complex, relational, and outcomes such as well-being, learning, safety, trust, they unfold over time and they can't easily be monetized. So there's several problems that come out of this. And the first one is that the way productivity is measured now means that a quote unquote efficiency gain that cuts, say, teacher-child ratios may appear as a productivity increase, but create worse outcomes through worse quality. So in this case, an increase in productivity does precisely the opposite of what we want it to do. And secondly, it really fosters this idea that the care economy is a drag, sending us broke or acting as a burden, when in fact, social services deliver immense public value, not only through the immediate gains in child development, well-being, learning, and health, but also the ripple effects such as reduced hospitalizations, health issues, crisis interventions, and strengthened community resilience. So if we adjusted productivity for quality, productivity in the care economy could actually look quite different. And we do have some evidence that supports this. So last year, the Productivity Commission found that when they did adjust for quality in the healthcare sector, productivity actually grew by 3% per year in recent years. And that was higher than the market sector at the time. So this really limits our ability to make good investment decisions. How can we actually say that productivity is stagnant in the care economy when we don't really know? Knowing what is working and what isn't helps us invest in the things that actually improve our society, our planet, and well-being. And last night's PC report does acknowledge this, which is great, without making specific recommendations, but it is certainly something we would hope to see worked on in the future. And the report also has many great technical recommendations. It is yet to be seen how they sort of contribute to a different way of working within government and communities in a way that shares power more, values the relational aspect of service delivery, and strengthens community resilience. So in summary, to answer your question, I think we need to really first reframe the way we think about productivity as a means to an end and not an end. And secondly, apply this perspective to how we measure and think about productivity in the care economy so that it really aligns with social value. Thank you.
Thank you. So one of the things that was contained in yesterday's report was a bit more of the detail that we've been looking for in this idea of a national prevention investment framework, which will go to some of, I think, what you were saying there, Adelaide, about how we can invest and the ways we do it. Ryan, I know this is an area of interest for you. What can you tell us about how the framework is shaped up so far?
Yeah, so one thing that I think is really great about the framework that they've proposed is that it's really based a lot on partnership, so how different government portfolios can work together, and also it also puts an emphasis on the kind of long-term thinking. So how do we broaden our horizons beyond just election cycles, budget cycles? How do we go beyond just the immediate costs of policies and things like that? And this is really important for this concept of productivity with purpose, because investing in prevention can create typical productivity benefits, right? So you maybe spend a little bit more money right now to prevent issues from happening, but then the government will save money in the long term. And that's a traditional, idea about what productivity means. But it's also, and more importantly than that, it actually prevents social harms from occurring in the same place. It helps build up people from the beginning so they can go through and live better lives. And that's like a really great demonstration of what we mean when we talk about productivity with purpose. And there's plenty of examples of this. If we provide safe and secure housing, then people are prevented from experiencing some of the physical and mental health conditions that come with rough sleeping. And, if we invest in early childhood as another example, if we build up their social, emotional skills early, they lead to better educational outcomes later in life. We can detect developmental delays earlier and address those. And once again, it creates both reduced costs for government in that they don't have to provide as many services down the line, but more importantly, it has a lot of significant social value, a lot of significant benefits for the people involved. And that's really what's at the essence of this, catchphrase of productivity with purpose. Some of the main barriers to this approach so far, though, have been a lot of the siloing between governments and that short-term thinking. And so the way that costs are calculated and the way that benefits from one department aren't always accounted for in other departments, and the ways that there isn't as much cooperation between the different parts of government. And so the draft recommendation in the interim report proposes a couple of different ways of addressing that. They've suggested a prevention framework advisory board, which can help assess prevention policies and help build those capabilities to start calculating those long-term savings that can come when you do prevention, and that helps choose where the government should invest to incentivize more investment into prevention. They talk about a couple of different, in the interim report, they talk about a couple of different funding mechanisms. One of those is considering the second round fiscal effects, which sounds like a complicated term, but what it basically means is calculating how the money we spend now can actually save us money down the line in other different departments, and thinking about mechanisms basically to allow for those calculations to take place and allow for budget proposals to actually consider those long-term costs and savings and how they work in different government departments. And so, as I mentioned before, some of those mechanisms that the Productivity Commission has proposed in the draft recommendations go back to this principle of supporting partnership between different parts of government, but also that long-term thinking, and that really embodies a lot of what we're talking about when we talk about productivity with purpose.
Thanks, Ryan. So you did mention, obviously, there's a monetary cost to late intervention, but then there's also a significant human cost. Kerry, as CEO of First Nations Advocates Against Family Violence, you know exactly what that human cost can be. What would a better approach to longer-term funding, perhaps even getting us away from bipartisanship and election cycles as drivers for funding and announceables, what would a long-term commitment and better partnership look like for you?
I think, looking at what Ryan and Adelaide is talking about is that sustainability piece. Sustainability also needs a definition that's pulled apart so that people understand it's really about that long-term view and looking at all those interconnections and plays in terms of economic and social. Before I jump right into it, though, I would also like to acknowledge the traditional owners I'm coming to you from, which is Kabi Kabi country, and pay respect to my elders, which is the Mandandangyi and Waka Waka people. And a lot of the conversations, I guess, that I bring to the table are those that my elders have pushed through in looking at, and there's been lots of conversations about the cycle of government and how we break that. I think, if we do have a couple of levers and tools like the Closing the Gap agreement and action plans, and particularly for our sector, for instance, there's the family violence planning, and it's how we utilise some of these tools to, I guess, push through on those accountability pieces. And I think it's locking in some of those accountability mechanisms that's going to help us to get some trajectory moving forward. But certainly, how do we get that sustainability and the acceptance across government? We need to have the data and the planning there to actually demonstrate that what we're doing at one point of the cycle, predominantly the early intervention and prevention, how that will fuel through to also alleviate. I guess the issue is you're not going to see it within 5 years. These societal change pieces are going to take, we've had, 200 years of colonialisation plus. And to undo that, we can't expect that's going to happen in a decade or two. But we need to be able to ascertain if we're on the right track, that we're getting the results that we need to help the trajectory, because we chop and change so quickly that we don't get enough time to get traction to demonstrate that what we're doing is working really well. And I think there's lots of example across lots of communities where solutions are working really well and they can get some traction over a period of time, and then they become unfunded because there might be a new stamp on something or a new view. So it's how we do that collectively to keep pushing the point, which I think is where we're going to get new ground. There's so, for instance, we're working on what's called a sector strengthening piece, which brings in a lot of the action plans. We're working on that with government. There's going to be actions in how we're building capacity of the sector. It's how do you get buy-in and how do you get those plans to resonate across an entire country through to grassroots, because we all need to be rowing in the same direction if we're going to really address and have an impact overall. I could probably bang on for the next hour, but I won't, to give everyone time to talk. But I think really for me that it's that we need to pull it upstream. We've had very little in the early intervention prevention. There's been a lot of talk in that space and there's been some pilot programs, but we're still really in the tertiary end, which needs to occur. And I think anyone who's worked in the grassroots areas knows we need investment, a dual parallel process. And data is not something that you can readily capture, particularly when we're talking about productivity and outcomes, because that means something very different for us in our community. So there needs to be a way that we can allow communities to talk about outcomes and what success looks like in a very different way, but have the same impact.
I'm going to throw it open to the rest of the panel there, because there's a few threads that I know that I suspect Caroline's going to want to pull at least one of them.
Well, no, Kerry, I'm so interested when you talk about this dual track, right? Like I always feel like in government, sometimes we kind of swing wildly and we're like, oh, well, let's go invest lots and lots of things in prevention over here. And exactly as you say, kind of 2 years later, it's like, well, we haven't seemed to have prevented all the problems. So let's go back to putting all of our spare cash and money over here in the kind of pointy end. How the disruption of that dynamic, you've talked about sustainable funding models. Do you think it's that also the closing the gap targets are going to act as a way of kind of forcing us to have that longer term vision? Like, how do we kind of maintain momentum?
Yeah, great question. I think the 4 priority reforms, really, if we're meeting all of those, the targets should be being met. Essentially under that. We know from the latest Productivity Commission review that we're not making traction on a lot of those targets. There's not a lot of data there in certain circumstances, certainly on target 13, which directly affects the sector that I represent. We've got one measure that has not been measured since 2019. But I think it's getting the buy-in for those 4 priority reforms. And the difficulty is for people to understand how does that translate to either a government department or to an ACO on the ground. How do we actually move this into action and commitment across our federated, model of government, which is a real challenge because federally they might agree to do X, Y, and Z, and then 1 or 2 jurisdictions might agree. So how do we get that the buy-in for the priority reforms? Because I think the intention of the priority forms and how they're written are really key pieces that was heavily consulted that the sector all agreed on. So we've got a great tool and a great starting point. It's how do we get the momentum behind to actually deliver on that?
Like I work in early childhood mostly, and one of the things about the kind of the recent closing the gap data on early childhood, as compared with, they did the big release of the AEDC universal data, and I think Snake's really drawn our attention to the fact that this is one of the spaces where kind of the general Australian population has done very badly in its AEDC results. And actually, when you look at it, Aboriginal kids, and particularly Aboriginal kids in areas that are well serviced by ACOs, haven't lost nearly as much ground. And so I think that kind of question around being able to see the like that's not an immediate impact. That's off the back of a lot of long-term investment in ACOs and ECEC. But I think that's becoming such a powerful narrative in most early childhood policy conversations I have now. ACO delivered ECEC is kind of considered as that gold standard of how do you do integrated whole of community, whole of child work. So like there are bright spots, but I'm trying to work out how we systematize that. Hey.
Well, and yeah, I think it's particularly, I think with education and health in those areas, there's a structure, quite a heavy structure that's already there that can be built upon and changed. So for instance, in the health structure, we've got the Medicare. And then you have the education. So you've got kind of these structures. So I think systematically, in terms of transformation, it's not easier, but we know that self-determination and solutions from communities is where you're getting results. So where you've got a higher proportion of Aboriginal and Torres Strait Islander children accessing a school, there's an ability to kind of manipulate that in a way that's positive for those children. Where you have a handful of Aboriginal and Torres Strait Islander kids in one mainstream school, it's much more challenging. But you're right, I think there's some traction. How you get that across our legal sector is really different, given the very different legal frameworks, whether it's federal and jurisdiction. There's no kind of national approach to that. Look, if I could take it and pick it up and put it in, we would certainly do that. But I do think you're right. There's some solution and some successes in there that speak to supporting that self-determination, and when you can focus on that and really co-design, and with the place-based, there's good examples with that as well. When you've got the ability to do that, you can actually see the results. So that should propel us, hopefully, with that ripple effect moving forward, to use examples where it's working really well.
I'm going to pick up on that point, Kerry, about getting decision-making closer to the ground. Before I do, I will just say to our audience that if you have a question for our panel, please feel free to drop it in the chat or the Q&A, because I do have a couple of questions that came in with pre-registration, and one of them goes to this. Another element that came out in the report that was released last night was around how we can change the way government buys services to get them closer to the ground, to think about how different organisations buying services, different parts of government buying services, and different organisations providing services can work better. And that's all wrapped up under the heading of collaborative commissioning. Now, Ryan and Caroline, I know you've been doing some work together on how this can work, not just in health, which is the focus of the Productivity Commission's report, but in other parts of the care economy as well.
Yeah, so, and I mean, it's a beautiful segue. I think I saw Alison Roberts from the PC online here, but one of the recommendations in the PC report is around this idea of collaborative commissioning in health, and it's about making use of the existing architecture. But Kerry, exactly to your point, it's about making use of state architecture, local health networks, Commonwealth architecture, primary health networks, and ARCHOs. And it says, Aboriginal community controlled health organisations. So it says exactly this question of how do you make use of the existing architecture that is there and get joint planning, so that you bring these organisations which have overlapping but not entirely congruent, but also not completely separate interests in what they're doing, getting them to do joint planning. The thing you talked about, Kerry, before, development of data sharing arrangements so that you can do joint needs assessment, and then joint evaluation of the impacts of your intervention. And I think there's a lot to really like in the framing of this collaborative commissioning recommendation, because it's both about, I think it also gets to this long-term question that Kerry was talking about. When you've got more than one funding partner in the pot, it actually is quite a bit harder to chop and change. It's always just worth saying that out loud. So we hold each other to account for a longer timeline and longer horizon on what we're spending. It also is, as Diana said, about getting closer to the community in terms of thinking about, you've got different levels of government, different kinds of perspectives in that joint planning process, and people bring it in. But the thing I really love about it, and I'll let Ryan talk about the work we've done in the South Australian Child Protection System, is that when you've got more than one commissioning partner involved, you're kind of forced into a learning cycle. Because the thing is, even though you are working together, you are, of course, both separately accountable back to people who wanted things from you, right? Like, you got money to do a thing. You've now got to go and work out, how am I going to get my thing in partnership with? So I want better infant health outcomes for Aboriginal kids in this area. I've got a bit of money that's about maternal child health outreach. You've got a bit of money that's about GPs and immunisation. And maybe the Archo's got a bit of money that's about, I don't know, playgroups or whatever. How are we, let's all work together on that. But actually, what it then gets you to do is you're like, well, actually, what did we want from this money? What were the outcomes? What have we learnt when we tried to do it this way with this? Did it actually work? And you have those honest conversations with each other, rather than sort of being like, oh, well, I don't think that worked, and we'll just cut that funding off, or there's something new and shiny over here. So I think there's something really powerful in this collaborative commissioning space. In terms of learning system, I'll throw over to Ryan, because actually what we looked at in child protection was a little bit less collaborative commissioning and a little bit more about bringing a range of different non-government and government providers together to build a whole system that learns. But Ryan, do you want to take it away?
Yeah, for sure. And I think there's a few points. So the specific project that Carolyn's referring to is doing a bit of work with the child and family support system in South Australia. They have a really great range of ways that they approach learning. They have quite comprehensive data collection, but that data collection they have a lived experience network which informs their data collection tools, which is really great, and actually does a bunch of stuff throughout the system, including training programs for practitioners and things like that. And they also have really great communities of practice where they bring providers together with government to all share learning between each other. But one piece that's quite important, and I think it goes to the point about working within the existing infrastructure, is their approach to the contracting. And so some of our conversations that we have with people, there can be a perception that commissioning more collaboratively or contracting in a more kind of relational way where it's focused more on the relationships between people. There's sometimes a perception that the government's requirements around accountability and, the rules that they have around how they procure things can get in the way. And there is some truth to that, but there actually is a lot you can do within those traditional contracting tools. And so in that particular case, the child and family support system in South Australia they do still have, KPIs and things like that. They do still have, minimum requirements around financial reporting and things. But the way they go about the relationship between the government contract managers and the service providers is a lot more about just ongoing communication. It's about sharing information, sharing those learnings with each other, both parties being open to feedback about each other. The government contractors are more than happy to adjust KPIs in certain contexts where it's really clear that actually they've gotten it wrong, and they take the feedback from the provider. So there actually is a lot that can be done. There's a lot that's already going on about making our approach to commissioning services and our approach to contracting with different parties, making it more collaborative, making it more focused on the relationship. And I think it's really important that as we move forward, that we learn from these existing examples and think about how can we keep taking it forward, because the Productivity Commission has some great draft recommendations in the health sector, but how can we take those learnings in the health sector to other systems? How can we, learning not just within the system, but across the entirety of our country and across jurisdictions, how can we all keep building our capabilities to keep this collaboration going between everyone? So, yeah.
So I've got a question for you there, Ryan. In the South Australian work, because collaboration, relationship building, learning together, none of that comes for free, and none of it is easy to do in the spare time and off the side of your desk, which is one of the reasons why I was particularly happy to see the Productivity Commission's report call out the need for specific funding for that, particularly for smaller or more specialised organisations. Is that one of the things that's made the South Australian project work?
Yeah, absolutely. I think one thing that's really struck me is the culture in the Department of Human Services and the leadership. And I've heard from various people that I've talked to there, the dedication, like the actual commitment to resourcing. So, one example of that is the lived experience group does have a dedicated staff to coordinate that and bring everyone together. They provided the lived experience people are provided support like childcare when they're having meetings, stuff like that. So there's a lot of, dedicated staff to that relationship building stuff, dedicated budget to that. And I completely agree. The point in the Productivity Commission's interim report around resourcing is definitely an essential part of that. And I think, like I mentioned before, it comes back to just that commitment from the leadership and that culture that really values the importance of collaboration and learning and lived experience and things like that.
Would anyone else on the panel like to respond to or riff off Ryan's point there?
Yeah, I was just going to comment that I think collaborative commissioning is one way to address some of the issues with our market-based social service systems. And that really funding is quite a powerful lever that government has, because it's not just about how services are delivered, but it can shape who holds influence and how power is shared. And yes, I think collaborative commissioning is one way, because it really incentivizes that collaboration between services, and it's as opposed to a more kind of competitive model. And the other way, we certainly talk about it in terms of early childhood education and care, is thinking about how government actually funds these services to incentivize that outreach, to incentivize that collaboration, to really incentivize that community leadership and strengthening that resilience. So there's many different ways, and funding is a very important way to try and share that power.
There's examples, though, of where those incentives have not quite worked as intended, because that's the nature of complex adaptive systems. For example, in defence a few years ago, the Major Service Provider Program encouraged or required large multinationals to partner with Australian organisations who tended to be your smaller, more nimble, innovative people who are coming up with the goods in the IP space. But the power differentials between those organisations and the big multinationals led to some very difficult situations in terms of those smaller organisations maintaining their IP. I think there's probably some parallels there for ARCHOs and ACOs, and for communities who have organisations coming in and seeking their experience, their expertise, which is why I was particularly pleased, Ryan, to hear you talking about how the South Australian project has really valued that lived experience. Thoughts about that? Kerry, you're off mute. Did you have something?
Yeah. I just wasn't sure whether you were headed towards Ryan. I think with the collaborative commissioning, it's almost a bit of an oxymoron in my mind, only because there's usually like a lead. There's some type of a lead within that collaborative model. And I think as soon as you've got the lead, then you've got the power imbalance within the collaboration or that model. I agree, it takes a multi-prong approach, which is what the intention of it is trying to do in terms of the collaborative commissioning. But if there was a way that, and some of it's to scale down really, so that government doesn't have so many contracts across so many players. But in doing that, you actually are reducing the power for some organisations to have that direct relationship. It's really important that people understand what their roles and responsibilities are in whatever change they're trying to do within their community. So enabling them to have their own ability to influence that piece of work and for it to evolve. I think when it's kind of put into that melting pot kind of scenario, that you can lose the richness of what each organisation is bringing. So if there's a way that you do that collaboration where you've got kind of all the threads of a blanket coming together, but you all own your own thread, you understand your piece in that, and that learning that kind of happens over time can have more people around the table who feel empowered to change and to test things, as opposed to trying to get a larger ship to all turn together. I know I just used completely different metaphors in the same paragraph, but hopefully my point was clear.
Oh, I love that metaphor, Kerry, because I think this is the tension in this whole conversation. And I'm really sorry because I've set us up very confusingly. There's kind of two elements to the collaborative commissioning we're talking about. One is kind of multiple funders and one is multiple recipients. And we might see anyway, but I think one of the real tendencies in all of this work is, the seeing like a state, when you've got a bureaucracy that is commissioning a thing, there is always a tendency to try and, you talked about a league, a tendency to try and widgetize it, to try and standardize. And there's been a big conversation in ECEC at the moment about universal, not uniform. And I think one of the things that we are trying to grapple with is how do you have a system that learns, which means that it is looking at what is happening and trying to get better, but that learning process is not a process of flattening out difference. It's not a process of thinking about all things must look the same. And I never think there's a good answer to this, except that people have to pay attention to the fact that that is something that might happen. And maybe I'll give an example from the South Australian child protection example. So, one of the things they did is they did a kind of standardised intake assessment of the complexity of families, and then they do a standardised outtake assessment of kind of what are the strengths that families have on in and out, and kind of how did that match against their complexity and whatever. And as they go through this process, you've got lots of different service providers, including dedicated, and this is a really great South Australian initiative that's, dedicated ACO funding over here. And so then you can look at it and you can say, right, well, so what do we see about the general population and kind of the average, the average improvement is X. But Kerry, exactly to your point, the average improvement delivered by the average set of service inputs is not the right set of service inputs for every community. So then they sit down and they're like, right, okay, well, let's talk to the providers that are getting the most engagement. What are the tools that they're using? Right, but when we bring that to our community of practice, what does everyone else say about, well, why don't we use these tools? And what does that, like, there's a learning process about what works for who. Like, some things work differently for some communities and some things work better for other communities. And so data, outcomes, yes, conversations, not imposed kind of, well, now, of course, you must all do X and Y. But if you put information in front of people and say, well, look, the services that get really good levels of engagement do, for example, showing up on a door and knocking at a door. That's a marker of kind of getting good engagement. There's no service provider who doesn't want good engagement. Every service provider wants good engagement. So putting the evidence in front of service providers, and then if a service provider says, well, actually, we don't do knocking on the door because our experience X and Y, that's a really good conversation too, right? Like, that is a learning process that isn't a standardizing process. Okay, well, which families might it work for? Okay, yeah, we'll start using it with them. Oh, did it work? Yeah, okay, it's working there. Like, and I think that kind of human system is it sounds very hard to scale. I'm a public servant and I kind of think, oh gosh, that sounds really hard to scale. It's actually not that hard to scale. It actually, just to Diana's point, means that we need to invest time and resources in sitting down and doing shared sense making, government side, community side, provider side. What is this telling us? And then we are brave and we hold hands together and say, we're going to try something. And if it doesn't work, we're not going to yell at each other. We're not going to cut funding. We're not going to go to the media and say, this didn't work. We're going to come back together and we're going to try something else. That, to me, is the kind of art of what we're trying to get at here. And props to the Productivity Commission, because I do think the framing they've set up in the health space, because it has all that infrastructure, will be able to do it.
And I think that takes us right back around to where Adelaide started us off, which is that people are not units and communities are not widgets, and standardization is not the right way forward in the care sector. So a really big part of this for me, and of course I'm going to say this because along with everyone else on our panel today, we are a connective tissue organisation that does some of the knitting together, the bringing together, the learning together, the sharing, the disseminating, the connecting up. So here is a question from Julia, which is all about the connecting up, which is about families and children who have to cross borders for services, whether that's due to geography or complexity. How do we solve that one? The joys of the federated system.
I'm happy to jump in on this one while anyone else thinks about it. So I was lucky enough to work in the Department for Education during COVID, and South Australia has a very big land border with Victoria and with New South Wales, with Northern Territory, but we have a highly populated land border, in particular with Victoria and a bit with New South Wales as well. And I've never felt more acutely the kind of random ways in which state borders made a real difference to what was available to kids. Because what we learnt is that kids had been accessing support on both sides of the border. And we learnt these were kids who lived between two different states, right? So I think, so that was the thing I learnt sitting in Adelaide in the centre. The other thing I learnt is everyone on the ground already knew that and had a range of different accommodations in place that they were already kind of juggling. And it was only once literally we had cops stopping buses at the border that things became a bit trickier. So I think some of the conversations that we've just had about collaborative commissioning are a really good starting point for this, providing a framework by which we can share our inputs into service delivery. But actually, I think also one of the things that certainly government can do is to be less picky about where its money is going, because one of the things I realised is there was a lot of South Australian government money going to Victorian kids who were in fact crossing the border to come to our schools or to, and there are a lot of South Australian kids who were getting services the other side of the border. So I think some of it is when you're in the commissioning space being open to the idea that it might not be all your citizens as you're doing it. Some of it then I think is also about supporting that local infrastructure that does a lot of the cross-boundary work. And I know that local government often does a really good job of this. Like you will find the people who all live in that 70k kind of boundary region. The most important thing is to not let stupid get in the way. And that's something that we find hard in government because we're quite like a rule. But usually when it's pointed out how stupid it is, actually you can find someone in head office who can make an exception to that rule. I think that's what we need to kind of start really expecting, that government will be flexible and human in that way as well. But maybe that's a bit Pollyanna.
Oh, I don't know. I think if we could all take that more generous approach and believe that it'll all come out in the wash, if we don't get clutchy. So that does take me to one of the questions that has been coming through from the audience. In fact, there's a few questions which are about that theme of power dynamics and how we can get decision making further down, closer to communities, closer to families, include children. And so this is a question for all of you. Pop when you're hot. One of our audience members is asking for good examples of governance models where decision-making is shared with communities.
I'm happy to jump in and give an example. So currently in our sector, we have the Federal Circuit Family Court of Australia, which is also known as the FCFCOA. That's an acronym. And the current Chief Justice is really keen on supporting the ACO sector. And so they do circuit family law courts, for instance. His ability to influence is very high in terms of changing some of those structures. And he goes out to community and his judges go out to community, and he's out getting feedback from on the ground, not only from the legal professionals, but also from the judges about what are the issues, what are the barriers, with a genuine interest of challenging those. So some things that he has implemented is to change in South Australia. They've changed a court. It's actually a round court, for instance. So when people are going, and how he's looking to demystify the whole court process in some way to make it much more accessible. So, they're employing people within the FCFCOA to look at accessibility and to make sure that people feel comfortable, or if people are concerned about the court for whatever reason, that there's other ways that they can engage. He's implemented a couple of dogs now to be in the courts for children so that they're feeling really comfortable in these processes. So I think in terms of that's a great example of what one individual can do in partnering and looking at co-design that has a successful outcome that kind of really is across everyone who accesses that federal court. And then other courts are actually starting to look at, well, why is it? Because they can actually see that they're cutting through caseloads, they're reducing numbers, they're resolving matters at a much higher rate. So therefore, some of those designs, are really helpful in terms of the person on the ground. And that's part of our role as a peak, is to take grassroots ideas and innovations and pull them through up into where there's legislative changes or policy changes. Yeah.
I might add to that with another example, because what I heard a lot from what Kerry said was around what makes it successful is the relational work. That's really important. And we are currently doing a case study on the Child and Family Learning Centres in Tasmania. What's really unique about them is that they are first and foremost welcoming meeting spaces to create that community connection. It's not based around whether someone has a problem or whether they need to go to a service. It's first and foremost trying to build that sense of community. And there's sort of home-like spaces where families with children aged 0 to 5 can sort of come in, gather, play, connect, and then if they need to, access various services. And the thing that was really important about some of these centres is that they were developed through a very long consultation process. It was about 2 to 3 years. And central to was the idea that community needed to own these spaces. And the relational work was actually funded, and it's part of what centre leaders' core responsibilities is to build those relationships with families. And I think it's particularly important given that so many families don't have that trust in the system or government services. And so creating that relational atmosphere is really is really important. And we just had an interview the other day with someone who was responsible of setting up these centres, and in terms of asking what were the kind of conditions that led to their success, the first thing that they said was the fact that those delivering it knew the value of relationships, and relationships were central and important and incentivized.
Yeah,
Terrific.
I think
Sorry, go on, Caroline.
Well, it just makes me think. So if we're grappling with this idea of we sense that traditional notions of productivity are not cutting the mustard, they don't incentivize the systems that we want to see, which are relational and deliver outcomes for families and children beyond kind of individual narrow silos. And maybe you can't measure even the benefits of the thing. So this is our starting proposition. The challenge with all of these examples is it's then like, how do you make that interface with a government system that is set up to think in big chunks of programmatic work, which, to Kerry's point before, kind of like things to all kind of, which move to a standardized and uniform process. And also, I think, operate like the way that we set stuff up as public servants, kind of necessarily like you do a business case. Well, if you're doing a business case, that means you need to describe what is the project you're exactly doing up front. That makes it really hard to do co-design, right? Because you've gone to get money for a thing and you've had to say, this is what I'm hoping to get out of the thing, and then this is what I expect it to look like. And you can't get the money from Treasury to do it if you don't do that. So there's like a whole kind of substrata of architecture that forces us into a way of working that increasingly I think we recognize is not the most effective way of working. So I think there's something for me in this conversation about, it's not just about kind of what we measure, it's also about how we go about it. And I don't have great answers, but for example, Adelaide, that child and family centre story in Tasmania, I may have this wrong, and for any Tasmanians online, please jump in the chat. My understanding is that was a little bit of a rescue job of something that had been announced, like done the announce and defend thing, and actually the community didn't love it. And so then they're like, oh, right, okay, no, we're going to go and we're going to change it a little bit and we're going to make it. And that's actually often how good things happen, right? Like often good things happen because governments announce something stupid, get a huge amount of pushback, and they're like, well, I've got this money now, maybe I'll go and spend it on something people actually want. And so I think there's something for us as the community about how do we encourage them to feel safe to come and have those conversations, and also kind of like feel like if they come and have those conversations with us, we're not going to ask for everything. Like, and I think that's always the hardest part for government as well, is they're so worried if they open up a conversation about what do you want to do, they think you're going to say, I want $1 billion football stadium, for example. Can't imagine why that sprang to mind. But actually, if you ask Tasmanians what they want to do, turns out they might actually just really want a little bit of investment in local social infrastructure. And so I think there's something for me about the scales at which we talk. And again, I like the way the Productivity Commission draft report has tried to kind of surface some of the architecture of how you might do it. You might do it through a prevention fund. You might do it through collaborative commissioning. Like, they're trying to build us an architecture that we can use. Anyway.
So there's some guidance there, isn't there, about what the prevention framework might look like and the kinds of criteria you might apply and the ways in which you might look to strike the balance between standardizing assessment and allowing for relationality and tailoring to community need. All these tensions.
If I could just add one point to that, I think another good example of particularly smaller organisations, how do they shine, in this environment? And I think the Productivity Commission report, looking at the early intervention prevention, gives some accountability tools that they could build in. But certainly if you can get funded for pilots, like through Paul Ramsey or once you've got a pilot and you can demonstrate, it's hard to get the rungs on the board with government if you can't demonstrate where something's been effective. But there is a lot of smaller philanthropic avenues that services can try for smaller projects, which can be smaller groups of people. It doesn't have to be hundreds of people. It can actually be 15 people that we want to test an idea with. And then when you've got that, not necessarily the business case totally done, but you've actually got an example of how you've been able to change lives and measure what's important. So if it's measuring the connectivity back to community or feeling connected, feeling like your identity, it actually starts the government thinking in different ways. And you can use that tool to then present either at conferences or other things. And it does end up having an effect because people get really interested in what's happening. And there's really not a lot between that and kind of like that. It seems like it's a really far away, how you can influence policy, but it's actually not that far. So I would just encourage everybody to have a look at when there is the opportunities to have input. There is community of practices if you don't have the resources to change legislation and policy. So we have one, you could jump in and we actually put it out to the group and say, this is the position we're taking, would you like to add? So there is different avenues. I think it's just finding what they are.
That's such an important point, and we were talking about it earlier, weren't we? Even what feels like really massive policy changes or legislative changes or however you want to, whichever sort of big shift it all starts with influencing one person who influences another person and the ripples go out. Okay, we've got a few minutes left. I will just say that if anyone, any questions that we haven't been able to address, we'll try and get our panel to respond to offline. There's a few questions from people, Adelaide, who are very interested in the Tasmanian work that you're doing and keen to hear when that comes out. So I would say keep an eye on the Centre for Policy Development socials and website, because I know you guys are very good at keeping those up to date. But here we are at the end of our webinar. Thank you so much to our panel. I do have one final question for all of you, or it's sort of two questions in one. Economic Reform Roundtables happening next week. What's the one thing you want the Treasurer to take into that? And what is the one thing you hope comes out of it? Let's go to Adelaide first.
So I would probably say to recognise the full social value of the care economy, and that's not just the things that are quantifiable, but the things that might not be quantifiable but generate well-being outcomes in the short and long term. And I think it is important to approach productivity discussions with that frame, because in the end we do need an economy that serves people and planet and not the other way around.
Okay. Caroline, do you want to go next?
Yeah, I think I would say to the Treasurer, if you want to use money wisely, we're going to have to learn how to operate differently. And I don't think we've built the toolkit yet for how to do it. I think we're on our way with some of the things we've talked about. And I just posted something in the chat about it. So I would say to the Treasurer, don't be afraid to invest in different ways of working, as well as kind of thinking about what the shiny outcomes are.
And I would add to that, don't be afraid to open up the tent for the people who are developing that different way of working, because policymakers don't have all the answers, program directors don't have all the answers. We need everybody, don't we? Ryan, what would your response be?
I think the main thing for me is that noting that at the moment, a lot of the relationships between people in the system are based on compliance and accountability, and it should actually be about alliance and partnership. And so we've already, as Carolyn mentioned, we've already started building the toolkit. We already have some ideas on how to do it. We need to keep looking at what's working and keep proliferating these successes around the whole system. Look at what works in different systems, spread them to each other. And as Adelaide was saying, not only does that create kind of those traditional productivity benefits, but it actually creates a lot of social value, and you need to equally value and account for all those social outcomes and benefits to people. And like I said, partnership and alliance is one of the ways to get there.
Thank you. Kerry, take us to the bridge.
Sure. I think for me, I would be saying a lot of what you all have just shared, but certainly it's okay to take risk. I think it's about how can you provide resources to something that's working and to test it without a fear. If something doesn't work, that's still actually a way to move forward. So I'd certainly not only be saying opening up the tent, but, the accountability goes both ways. And it's actually okay for the government to pass that accountability or risk over to a community who's got a great idea to test it. Because again, coming back to the ripple effect, that's that parallel process of looking upstream as well as the tertiary. So I think we're kind of all saying the same things in a different way.
And I think approaches to risk could be a whole webinar of its own. Perhaps we'll have to get the band back together later on in the year. Okay, thank you so much to everybody for joining us. Thank you to our panel for this stimulating and informative discussion. The recording will be available on the ARACY website in the next few days. And our final webinar in the Productivity with Purpose series we're shaping it up at the moment. And one of the things I have discovered with this series is that when you have clever and fabulous people on your speaking panels, it's really hard to find a time when they can all get together. So keep an eye on the ARACY website and the socials for when we get that one finalised and pinned down, because it will be just as good as the two that go before us. Thank you again to the Centre for Policy Development for partnering with ARACY on this series of webinars. And thank you again to our wonderful, fabulous speakers.